So you've got that gnawing back or neck pain, and someone's mentioned an epidural steroid injection. It's a term you've probably heard, but there's so much confusion out there. In this explainer, we're going to cut through the noise and get to what these injections really do. And we'll tackle the one question that's on everyone's mind. How long does the relief actually last?
Just picture it for a second. You've been putting up with this sharp, shooting pain zinging down your leg or your arm for weeks, maybe even months. It just won't quit. Then your doctor brings up an epidural. And for a moment, there's this glimmer of hope, right? A way out of this misery. But what's really going on in there? Is this a permanent fix, or are you just hitting the pause button on the pain?
Okay, first things first, let's clear up a massive misconception. When people hear epidural, their mind immediately goes to childbirth. But that's a labor epidural. Its job is to numb everything with a continuous drip of anesthetic. An epidural steroid injection, or ESI, is a whole different ballgame. We're not trying to numb the pain, we're trying to put out an inflammatory fire around a nerve with a very targeted dose of steroids. So two different tools for two very, very different jobs.
So if it's not just a numbing agent, what's the magic here? What's it actually doing? Well, the secret isn't just about the steroid itself. It's about understanding what's truly causing your pain in the first place.
You know, we all use the term pinched nerve, and we picture something being physically squeezed, right? Like a clamp on a garden hose. But here's the kicker, and this is so important. A huge part of the pain from something like a herniated disc is actually chemical. The inside of the disc leaks out these inflammatory substances that are just toxic to the nerve. That's what we call radicular pain, and it's that chemical fire that the steroid is built to fight.
The absolute best way to think about it is like this. That chemical irritation is like a small fire starting up right next to your nerve. The steroid in that injection, it's not a painkiller. It's a fire extinguisher. It's designed to go straight to the source and douse those flames of inflammation.
And on a deeper level, this is how it puts out that fire. See, corticosteroids are pretty amazing. They launch this multi-level attack. They stop the body from producing the very chemicals that are causing the inflammation. They help stabilize the nerve itself so it stops firing off those haywire pain signals. They can even help prevent scar tissue from gumming things up later on. It's a really comprehensive approach.
So, what's it actually like to get one? Honestly, it's a very precise and controlled process. You'll get positioned, usually on your stomach, and the area is cleaned thoroughly. Then the doctor uses a special kind of live X-ray called a fluoroscope to watch the needle in real time. This is not a guessing game. They guide that needle right to the perfect spot, inject a little bit of dye to make sure they're exactly where they need to be, and then, and only then, does the steroid medication go in.
And this is basically what your doctor is seeing on their screen. It's their GPS for your spine. They can see the bones, they can see the needle, and they can see how that dye spreads out. Using this kind of visual guidance is absolutely essential to make sure the procedure is not only effective, but also as safe as possible.
Okay, and that brings us to the million-dollar question, right? The one everybody wants the answer to. Once this is all done, how long am I going to feel better? And this, right here, is where we really have to manage our expectations.
The honest truth is it's all over the map. Our source material puts it perfectly. For many, the relief is short-lived. We're talking weeks or months. But it's also true that for some people, in some cases, the relief can be really, really long-lasting. So there's just no one-size-fits-all answer.
And a huge piece of that puzzle is why you have the pain to begin with. The diagnosis is everything. For that classic shooting nerve pain from a lumbar disc herniation, the evidence says these injections can be quite good. For something like spinal stenosis, it's fair. But for that general, achy low back pain that doesn't shoot down your leg, well, there's just not much evidence that an ESI is the right tool for the job.
So you have to shift your thinking. The injection isn't always meant to be a permanent cure. So often, the real goal is just to break the pain cycle. Think about it. The pain is so bad you can't even think about doing the physical therapy or exercises that could actually fix the problem long term. The steroid's job is to calm things down enough to open up a window of opportunity for you to do that real work.
And here's a little insider tip they might not tell you. The relief isn't instant. The steroid needs time to go in there and do its job, to actually reduce the inflammation. It's totally normal for people not to feel a major difference for maybe 4 to 7 days after the shot, so you gotta be a little patient.
All right, with any medical procedure, we have to talk about the flip side. We have to talk about the risks. It's really important to go into this with your eyes wide open, understanding both the pros and the cons.
Now, most side effects are pretty mild and go away on their own. We're talking about things like some soreness where the needle went in, maybe you feel a little flushed for a day, or if you're diabetic, you might see your blood sugar tick up for a bit.
A dural puncture headache is also a known risk. It's less common, but it can happen.
And of course, we have to acknowledge that there are rare but very serious complications. Things like bleeding, infection, or nerve damage are possible anytime you're working near the spine. And the most severe risks, like a spinal cord injury, have been traced back to a specific type of steroid, which leads us to a really important distinction you should know about.
So the steroids used in these shots basically come in two flavors, particulate and non-particulate. Think of particulate steroids like fine sand in water. They have these tiny crystals that don't fully dissolve and can clump up. Non-particulate steroids are more like salt in water. They dissolve completely. The reason this matters is that those tiny crystals in particulate steroids can, in very rare cases, clog up a tiny blood vessel, which is what has been linked to those devastating injuries. For that reason, a lot of doctors now prefer to use the non-particulate, fully dissolving kind to make the procedure even safer.
So, after all that, what's the bottom line? We've talked about what an ESI is, how it works, how long it might last, and the risks. What do you do with all this information?
If you remember just one single thing from our whole chat today, make it this. An epidural steroid injection is not just a painkiller. It's a strategic tool. Its true power is in putting out that fire so you can finally participate in the rehabilitation that leads to real, lasting recovery.
And that really leaves you with one final question to ask yourself and to ask your doctor. Could this temporary relief be the exact bridge you need? The bridge that takes you from being stuck in pain to actively getting better? That's the conversation to have. It's not about asking for a magic shot. It's about asking if this tool can unlock your path to healing.